You know, most of us are used to waiting a long time before getting an MRI, but one Toronto woman with terminal cancer worries it's time she does not have. For more than 2 decades, Sarah Barnett has been in a fight for her life.
In 2001, I was diagnosed with an astrocytoma, which is a grade 2 brain tumor.
She now has stage 4 cancer. For years, she's had MRIs done to monitor her tumor under specific timelines.
Standard of care says an MRI every 2 to 3 months. It shows if there's been any growth or if it's stable. If there's growth, I go back on chemo for a year. If it's stable, I don't need to do any treatment.
But for now, she's stuck not knowing. The closest date she can get an MRI appointment is several months outside that window.
Then the next appointment they offered me was April 2025.
There's nothing sooner.
No, it means I could be dead by then.
That's your fear.
Yeah, and I mean, I've come to, with the 20 years of the tumor, I've come to terms with dying, and it's part of life, but I don't think it needs to be rushed.
This is not good news for the patient and others like her, and there are thousands of them who are caught in this same waiting game.
This is Kathleen Finley with PatientProtection.Healthcare, an organization that fights for better patient care.
Hospitals that provide MRIs for their inpatients are having a terrible time keeping up with them.
And she says for patients not in hospitals like Barnett, it's even worse, which is why back in June, Ontario's Ministry of Health announced a bold plan to tackle MRI delays.
The Ontario government announced that it was putting a lot of money into expanding the capacity for MRIs to be done in community surgical and diagnostic clinics. The problem with that is it's just a policy. It's just a plan. It's not on board yet. The planning for that just ended in August after they announced it in June. So who knows when the situation will improve for patients.
Speaker's Corner reached out to the ministry. A spokesperson told us they've already added 49 new MRI machines to local hospitals with more to come. Quote, our government is adding 100,000 new publicly funded scans to reduce wait times for MRI and CT scans to 28 days in every corner of the province. But the ministry was unable to give us a timeline of when that will happen. Patients like Barnett hope it's soon as she continues to look for an earlier appointment.
They're still trying. They put me on a cancellation list. I have a great doctor and they're doing what they can.
You just can't imagine what people are going through. Is this thing growing inside me? What is that going to mean for my prognosis? What are my treatment? It is a horrible thing to inflict on people who are already dealing with so much.
As always, if you have an issue, story, or question you'd like us to look into, we'd love to hear from you. Reach out by visiting our Speaker's Corner tab on the City News website. Pat Taney, City News.